When we think about knee osteoarthritis, most people immediately picture excess weight as the main culprit. But recent research presented at the World Congress on Osteoarthritis 2026 has uncovered a more complex story. It turns out that the combination of obesity and sarcopenia, a condition marked by low muscle mass and strength, poses the greatest risk for both knee osteoarthritis and the need for knee replacement surgery. Fact: individuals with sarcopenic obesity are about 50% more likely to require knee replacement than those with obesity alone, and more than twice as likely as those with sarcopenia alone. This finding shifts our focus from just weight management to a broader view of muscle health and body composition. Let's explore what this means for patients and healthcare providers. Searchers analyzed data from nearly 373,000 people in the UK Biobank, comparing those with sarcopenia, obesity, both or neither. They found that obesity alone nearly tripled the risk of knee replacement, while sarcopenia alone increased the risk by about 60%. But when both conditions were present, the risk soared to more than 4 times that of people with neither condition. These results were validated in a separate group, using different methods to assess muscle and fat. However, experts caution that measuring sarcopenia isn't straightforward. Grip strength and chair stand tests can be influenced by joint pain, and advanced imaging like DEXA scans might offer more accuracy. Still, the message is clear: muscle matters just as much as weight. So, what does this mean for managing knee osteoarthritis? Experts now recommend that muscle strengthening should be as important as weight management. Resistance and cardiovascular training are both essential, not just for supporting joints but for improving overall muscle quality, which affects metabolism and insulin sensitivity. While current tools for measuring muscle mass aren't perfect, the evidence supports a shift in focus. Healthcare providers should look beyond BMI and consider body composition when assessing risk. For patients, this means that building and maintaining muscle through regular exercise could be just as important as losing weight and preventing knee problems. The bottom line: a balanced approach that targets both fat and muscle may offer the best protection for your knee. Let's clarify what sarcopenic obesity really means. Sarcopenia is the loss of muscle mass and strength, often associated with aging, while obesity refers to excess body fat. When these two conditions overlap, the negative effects on joint health and metabolism can be amplified. Muscle isn't just for movement, it's a secretory organ that influences everything from metabolic efficiency to insulin sensitivity. Where muscle quality can lead to fat infiltration and reduced function, making joints more vulnerable. That's why experts emphasize the importance of both resistance training and cardiovascular exercise, not just for weight loss but for maintaining muscle quality. Understanding this concept helps us appreciate why a dual approach to prevention is so vital.